Um, our next speaker is Anil. We've, been partners for a long time now. Long time in the COVID pandemic scenario. I wouldn't say long time forever, but in the past 2 years. And Anil is from United Way Mumbai. They've been amazing partners to Daily Wage Worker platform, but they've also been at the forefront of the fight against COVID-19. United Way started their COVID-19 response interventions in March 2020 itself. They were one of the first organizations to respond very quickly to fight the spread of the virus, keep health workers safe, and also support community resilience. United Way is undertaking various interventions in difficult to access and underserved communities across the country to facilitate vaccinations. They've already supported 50 lakh plus community members in 30 districts in 12 states. These are huge, huge numbers. By overcoming hesitancy, facilitating registrations, and promoting COVID appropriate behavior. So Anil, first question to you today is, what, according to you, and especially the work you've done in the past 1 year on vaccinations, the biggest factors that cause vaccine resistance in India today?
Multiple things, Priyanka, but I must compliment Dr. Laharia for his inputs. I think going forward, we will be following his work very closely to understand and, devise our strategies as well. And Karen mentioned about this. She said, COVID-19 vaccination is a case study in behavioral science. I would go ahead and put a couple of more. I would say it's a case study in politics. It's a case study in economics. It's a case study in social dynamics as well in the communities. Across the 30 districts that we operate in, what we have realized is, Dr. Laharia commented on this, is that, it's an opportunity cost for many people. We've heard some ridiculous beliefs, people stating multiple reasons which don't have any logic behind them to say we don't want to get vaccinated. But you probe a little further and you realize the reasons are actually social, economical, or physical access to vaccine. And that's where our teams are geared up. We have around 300 plus staff members across the country as we speak, doing this, making the vaccination available to them, telling them that, of course, you have beliefs, you have a lot of, preconceived notion about vaccinations, but here are the facts. The 300 staff members that we have, Priyanka, are from the community itself. So there is a lot of, acceptance. They speak the language. They use the words that the local communities use. And that's where we are able to convert people. And the opportunity cost becomes a major hassle for us to convert anybody to go for vaccination. Opportunity cost will be a daily wage worker will not be able to spend 2 days to stand in a queue for a vaccination A, B, be down by fever and headache for next 2 days. 4 days of daily wages gone. That means that his or her family won't have money to feed. And that's the major worry. That's where the issue happens. So what we try and do is, try and bridge this gap, reduce this time, make sure that their registrations are done on time, and then they don't have to wait in the queue. Even if they have to wait in the queue for vaccinations, they are able to go, do it faster so that there is lesser losses on their part as well. So that's where the issue is. Ideally, the beliefs, the conceptions that people have is something that can be broken easily if we have one-on-one conversation with them, when we have one-on-one health inquiries as well. That really helps us. The second thing that I think feeds into hesitancy or probably reluctance to go get vaccinated is that the information on COVID-19 is ever evolving. You had Delta, you had some other variant, you have Omicron right now, and the communications related to vaccination also keeps changing. We have Covishield. You had a certain amount of weeks that were taken as a gap. Now we are talking about 8 weeks of gap, 8 weeks gap now. And this kind of information keeps changing. It's dynamic. And to make it easy for people to understand is the task, because then people don't really trust when we go and say, okay, you get vaccinated. They come back saying, okay, you were saying something else yesterday, you are saying something today, and day after tomorrow, you will say something else altogether. How do we trust this information? So that's, I think we need to keep that in mind as well. One logistical issue, one very simple issue that we faced across this 30 district is we had IEC materials prepared. in 12 languages. And this were local posters that we had put up about benefits of COVID-19 vaccination. And what we realized is that we had to keep changing those posters physically, get them redesigned, give new content, update it, and print them again, and then put it up every fortnight. Imagine the kind of understanding the citizens will have about the vaccinations. Yeah. So those are the issues that people do face. And I think that's where our challenges is as well.
Thank you so much, Anil. How is United Way working towards addressing, some of those challenges? We worked with you, but for the rest of us, how is United Way working? And especially because your geographical presence is huge, and it's created so much impact. So how is it addressing these issues?
First and foremost is partner with the local stakeholders on the ground. We are talking about ASHA, A&M, Anganwadi workers. These are unsung heroes of COVID-19 fight. These are people who are working on substandard wages. They're putting their lives at stake, going to villages, going to slum communities. You talk about a slum community in Bombay. You talk about tribal communities in Madhya Pradesh. They are the ones who are going out and talking about vaccinations and convincing people. Our effort has been to supplement their efforts through the staff outreach workers that we have, around 300 people who have been taken or employed on honorariums, who go out with these ASHA workers, A&M workers, or Anganwadi workers, complement their work, because they have huge universe to cover. They have to have so many villages, communities, slum communities to cover. So we try and complement their effort and really double up the numbers of number of outreach that we are undertaking. So that has been quite helpful to overcome our challenges. The other aspect that we have realized, and this is something that we started last year, early part of last year as well, was strengthening vaccination centers. Now, vaccination centers are not traditional hospitals in India specifically. These are PHCs, public health centers, primary health centers. These are schools in even cities like Delhi and Noida, Gurgaon have schools which have been converted as vaccination centers, and they are not traditionally equipped to undertake such a massive operation of people coming in, having the need to have proper medical infrastructure and supplies. And that's where we worked with the government as well across these 12 states to strengthen those vaccination centers, ensure that they are able to cater to huge number of people who are coming in, and try and ensure that they have enough adequate medical personnel who can administer doses. Wherever we have worked in the communities, our effort has been to reduce the queues, long lines in terms of vaccinations. So that has been our success factor here. Wherever we have worked, we've noticed that we've tried to reduce the number of hours in terms of waiting for people, so that they can get it faster, and then they're more receptive to get that as well. And I think that has been a key mitigation strategy for us.
Thanks a lot, Anil, and I'm so sorry I completely missed this point that you have 3 slides you wanted to show, which will actually answer some of my questions, because I know it talks about the geographical reach, the strategy, and the challenges faced. Would you want to share your screen?
No, it's fine.
I think Deepak can do that.
Yeah, it'll be, I like that map, India map you had done. Maybe you can, yeah.
Sure. Okay. Deepak, you can go next. Yeah, this is where we are. We started with a target of 5 million people. We thought we will help 5 million people get registered and get vaccinations. Current reach is 6.5 million as of now, and I think we will double the target that we have. This is not to pat ourselves on our back. This is to say the need for this kind of interventions on the ground, to say that there are so many people who actually need help in registering on COVID, or even going to the vaccination center. Dr. Laharia mentioned that people didn't even know where vaccination centers were. So the workforce that we are working with really help people in accessing these vaccination centers, to understand how do you go and access the centers, how do you register, even if you are not literate, how do you register, how do you get your help, even if you are not documented, how do you get your shot on the ground. So that's something that we are working on. Deepak, next. I think, Levi, I touched upon this, but one aspect that probably I'd want to cover is transportation of people from remote and rural areas and even tribal areas to the vaccination centers. And this was in the early part of immunization campaign that we had, to ensure that people have physical access to vaccination centers. And government early part of the vaccination campaign, they were not doing door-to-door or community vaccination drives. So the effort was to get people from difficult to access areas to the vaccination centers and ensure that they get inoculated. So that strategy has really worked wonders for us, and we've been able to track many people and ensure that they get both their shots. Next. What were the challenges? Priyanka, I think we covered this, but I would want to also highlight vaccine eagerness as a challenge, because one spectrum is vaccine hesitancy, the other is vaccine eagerness. There are a lot of people now who are supremely eager to get inoculated, but they face a lot of challenges on the ground. One of them was touched upon earlier about, they got a specific set of vaccination as first dose, but the second dose, the same vaccine is not available. What do you do? And then the wait keeps increasing. The other issue that we are facing is second dose coverage. Right now, specifically, I'm talking specifically for rural parts of the country where we are operational. Getting people to go for second dose and complete coverage has been a tough challenge for us. That has been our experience. I don't know how this is happening in other areas, but that has been a major issue because people have been laxed. They think that first dose is enough, and probably because the second wave has already gone, now we can relax a bit, so we don't need to get second dose. Probably those could be the reasons for that. Another reason has clearly been migration. People now are moving from rural or semi-rural or semi-urban areas to metros and cities, and that creates a different kind of a problem. You would have got your first dose in your village. Now you are in a city like Bombay, where you don't even know where the vaccination centers are. So how do you get your second dose? So those are challenges that we are facing currently. And a major challenge that we have faced, and especially this is in urban part of the country, is documentation. There are a lot of migrants who don't have documents, and getting them inoculated has been a major challenge. This requires working with the government officials of the vaccination centers and ensuring that they provide a different kind of service in terms of the inoculation to this set of people. Deepak, next. So that has been our experience so far, Priyanka, and any other questions we'll be happy to take.
Thank you so much, Anil. My next question was to understand successes, but that you've explained us, and also we saw on the first slide. But my last question to you is, what are the lessons learned throughout this process? Something you think did not work and something which worked wonders? If you could tell us about it.
I think for us, a humbling lesson was to think that people are hesitant to get vaccine. People have their own reasons to not get vaccine. I know even Karen mentioned about this, that we need to be more empathetic about when we communicate to people, not find the reasons to be ridiculous. Rather talk to them about what the specific reasons are. And when we probed people, we realized that the reasons weren't ridiculous. They were talking about opportunity cost. They were talking about their food for daily sustenance, and that's why they weren't going for vaccinations. That is a majority of the reasons what we realize, and that's where we try to facilitate vaccinations for them, and that has been our major learning. The second learning, of course, has been our communication being very simple, being in the local language with the words that people understand, and not trying to make it complicated and not have alien words for them to understand. And when you have people from the same community talking about vaccinations, people are more receptive.
Thank you so much, Anil. I have learned a lot today, even though I work in public health too, and I do a little bit work of vaccines, not too much. And obviously, being part of Daily Wage Worker platform, but today's session was very, very insightful, but also with latest information, latest data, and what's happening in a tribal village in Maharashtra to, what amazing work Australia is doing. It's just been amazing.